Hello everyone, it's Nathaniel and welcome back to another video. Today we'll be discussing children and COVID-19. As many of you know, children have very little risk of becoming severely ill with COVID-19. Today we're going to talk about some very important statistics. There are two medical papers I'll be referring to today, which I've linked below in the description. The first paper is a study of those under the age of 18 in Europe who tested positive for COVID-19. The second is a statistics report of children who tested positive for COVID-19 in each U.S. state. In the first paper, a study was conducted in which there were 582 subjects under 18 who had tested positive for COVID-19. In the study, about 8% of the subjects were admitted to the ICU. This sounds pretty scary, right? But what if I also told you that 52% of those patients in the ICU had pre-existing conditions? What if I also told you that 48% of those admitted to the ICU were under the age of 2? They didn't have much time to develop immunity. In addition, 15% of these ICU patients had another virus at the exact same time as the coronavirus. The reported statistics don't give enough information for an exact calculation, but with the information provided, the percent of normal children over the age of 2 who tested positive for COVID-19 and had to be in intensive care is extremely low. This brings us to another point. Only children who tested positive were included in this study. The second paper is from the American Academy of Pediatrics and the Children's Hospital Association. According to their reports, children make up 8% of confirmed positive cases in the United States. So, why do children make up only 8% of positive cases if they make up about 24% of the U.S. population? The answer is that children show much weaker symptoms to COVID-19 than adults. So much weaker that it appears only 1/3 of them show enough symptoms to even get tested. In addition, the mortality rate for children infected with COVID-19 is almost non-existent. In fact, 24 of 50 U.S. states reported no child deaths at all. The percent of positive child cases resulting in death is 0.03%. If only 1/3 of children who are positive are tested, that means only 1 in 10,000 children who gets COVID-19 dies from it. It is also very likely that this one child who dies out of the 10,000 is an infant or has a pre-existing condition. After looking at these papers, I believe it is of paramount importance to sample many children and test them to see whether or not they have immunity to COVID-19. If the data shows that a majority of them do, as I very much suspect, we can discuss the reopening of schools. Thanks so much for watching everyone, and please subscribe.